people in. Here we
Yeah,
go.
you might as well. Oh my gosh, hi, Paul.
Oh, different Paul.
Different, no, I was talking to Paul Volpe, but
Yeah.
whose picture I recognized. So lots of people I know there, and lots of people I don't. Okay. Hi, John.
Hello.
Hi.
All right. So good afternoon, everyone. We have, I think, some people probably trickling in from the waiting room over the next couple of minutes, but we'll go ahead and get started. I want to thank you all for attending and welcome you to the Lewis School of Health Sciences speaker series, a bioethics lecture. And our speaker today is Professor Robert Baker. Professor Baker is the Emeritus William D. Williams Professor of Philosophy at Union College and Professor of Bioethics and the founding director of the Bioethics program of Clarkson University and Icahn School of Medicine at Mount Sinai. So we're very lucky to have him. Professor Baker has an illustrious career in bioethics. He received his BA in honors in history from City College of New York, a PhD in philosophy from the University of Medicine, and he was a postdoctoral fellow at Albany Medical College. He's on the editorial board of Bioethics. He's been a 4-time National Endowment for the Humanities awardee. He's a fellow of the Hastings Center Bioethics think tank. And he's written, edited, and co-edited over a dozen books on bioethics, including the American Medical Ethics Revolution, the Cambridge World History of Medical Ethics, each of which were cited by Choice, the Journal of the American Library Association, as an outstanding book of the year in the health sciences. In 2013, OUP published Before Bioethics, A History of American Medical Ethics. Professor Baker is a consultant to the American Society for Bioethics and Humanities Committee that developed the ethics code for healthcare ethics consultants. And he co-authored a report prompting the board of the AMA to apologize publicly for its past treatment of African-American physicians. And I think that'll sort of conclude my introduction of all his accolades and achievements given his talk today. So Professor Baker will speak today on the topic of erasing Blackness from bioethics, how standard histories minimize, ignore, or deplore African-American and female contributions to bioethics. And with that, I will turn it over to Professor Baker.
Hi, okay, could you, okay, that's what I wanted. Okay, so that's this, I mean, that's the title. Could you go to the next slide, please? Okay. So there are 2 standard histories. One is Strangers at the Bedside. This is the first edition by David Rothman. It's based on archival research at the National Institute of Health and various archival materials in Washington, D.C. David Rothman was a human rights activist. He's a distinguished historian of medicine, and he wrote, as I said, the first major history of bioethics. Next slide, please. And that's this book by Al Johnson, and it's pretty much the standard history of bioethics. And Al wrote this. Sorry, Al was one of these everyman figures who showed up at almost all of the inflection points at the upper level of events that created bioethics. And he has personal memories, but he also convened a conference in which he asked all the people he considered pioneers of bioethics to write their personal memoirs. And he put all these papers together with his own remembrances, a little bit of original research, and wrote The Birth of Bioethics, which in some interesting ways is semi-autobiographical as well. Next slide, please. So I want to bring you back to the decades in which bioethics was born. Could you click it about 4 times? Okay, thank you. Now, the yellow are things that I focus on in my book. The manuscript, which I haven't got in my hands because it's big and cumbersome, the manuscript that I'm currently working on, but are not the focus of the 2 standard histories. They all acknowledge that in 1964, the World Medical Association published a document called Ethical Principles for Medical Research on Human Subjects. Neither of them focuses on the Nuremberg Code. Neither of them focuses on William Hyman, who is a Jewish lawyer and from Brooklyn, who sued the hospital for violating the Nuremberg Code. Neither of them focuses on the fact that 2 years earlier, in 1962, a woman, Frances Kelsey, took the informed consent part of a draft of the Helsinki Accord and inserted that into the Kefauver Harris Amendment, making it law in the United States. That's a little thing saying I should be participating. Next 4, please. They don't mention, and they probably had no knowledge of Schatz, a Canadian Jew, protesting the U.S. Public Health Services Tuskegee study of syphilis. Neither of them mentions the Beecher-Papworth correspondence, in which the both discussed outing unethical experiments. Both focus in large measure on Beecher's ethics and clinical research, a famous paper in the New England Journal of Medicine. Neither of them focus very much on Peter Buxton, who compared the Tuskegee study to Nazi experiments and would eventually blow the whistle on the study. Next 2, please. Both of them focus on the founding of the Hastings Center and the fact that medical school educators formed the first bioethics society, the Society for Health and Human Values. Next, please. Okay, run through the whole thing. I don't want to go through detail, but I do want to point to the 3 parts that are in yellow. None of these mention George Wiley, who's African American, even though he is the person that negotiated a patient's Bill of Rights with the Joint Commission, and even though he's the one who also negotiated it with the American Hospital Association. None of them mention that the American Hospital Association, even as it affirmed a patient's Bill of Rights, also put everybody on notice that they were not going to enforce it. As for the stuff in blue, that's in everybody's book. Next slide, please. Next. I think we jammed her. Well, in the next slide, if it appears, I guess Paul has to scan through all of it, click through, and one more slide. Okay. So why do I think why write another book? I mean, you've got these two standard histories. They're pretty good. I thought that they missed something. So my last book, which came out in 2019 with MIT Press, was called The Structure of Moral Revolutions. One of the conclusions that I came away with is that moral revolutions are created by dissidents, not by establishments. And the thing that's striking about the two standard history is they focus entirely on establishment figures and not at the dissidents. I want to argue that the dissidents who led the Anglo-American bioethics revolution used the Nuremberg trials and the model of the Nazi doctors as a touchstone of immorality. And they, in effect, measured what was going on in the United States and in Britain against what the Nazi doctors did. And this led them to challenge what was going on in Britain and in the United States. Next slide, please. So I started out with these four questions. Why do they all ignore the Nuremberg Code? And by the way, why do they not refer to it by its proper name? And why did its proper name go away? And why are African American, female, and Jewish protesters routinely ignored in these histories? Moreover, why do they date bioethics from the 1970s, even though it started in the 1960s, but they ignore that except for Beecher? So those, I start out with a group of questions. Next, please. So these are two infamous Nazi doctors, Karl Brandt, and he was in charge of a program that started out gathering and euthanizing children with disabilities, and ended up being in charge of a group of programs that went after children and adults with disabilities, LGBTQ people, and Roma, and most notoriously Jews. That started separately, was not what he did in particular. And he was put on trial for that at Nuremberg. And the other one is Josef Mengele, who again was tried for his unethical experimentation. So at the end of these trials, before anybody was convicted, two Americans, one Austro-American and Jewish, Leo Alexander, and the other one, Andrew C. Ivy, had collaborated to produce a document called Permissible Research on Humans. They had very different motivations. Leo Alexander, who had fled Germany, who knew people who died in the Holocaust, was a Nazi doctor hunter, and he wanted to bring them to justice. Andrew Ivy was motivated differently. Both Alexander and Ivy served in the military during World War II. Ivy's motivation was the fear that in their haste to condemn Nazi doctors, somehow or other, they would create a new anti-vivisectionist movement, which would argue that any research on human subjects was impermissible. And he was the one who conceived of the idea of what later became known as the Nuremberg Code, but he thought of it, and that's the official title, as permissible research on humans, because he wanted to argue that if you take certain precautions, it's okay to conduct research on humans. And that's what that code stood for. Next, please. Okay. Now, a little bit more about justice at Nuremberg. That's the name of historian Ulf Schmidt's famous book. And there on the cover of the book, you can see Leo Alexander, and he's got a Polish woman. The Polish women were kept in a separate area of, I believe, Birkenau concentration camps. Don't trust me on that. And the doctors would inflict wounds on them and then use various treatments to see what were the best ways of treating those wounds. And he was pointing with his finger to a wound that had been inflicted on her, and she was telling all the things they did to inflict the wound and how they treated it and so on. And Alexander, as I said, was motivated by a quest for justice, that these deeds not be buried. He's the one who documented all the deeds, and that these people not go unpublished. Both permissible experiments on humans and Leo Alexander are minimally touched on in the standard treatments. And let Rothman explain this in his own words. Next slide, please. Here's Rothman's explanation. Well into the 1960s, the American research community considered the Nuremberg findings and the Nuremberg Code irrelevant to its own work. That's true. That's absolutely true. But that's not a good reason for ignoring the Nuremberg trials and the Nuremberg Code, because from my perspective, the question is not what the establishment thought, not what these famous researchers thought. The question was, who were the people who were going to make trouble? Who were the people who were dissenting? What did they think about the Nuremberg, what they called the Nuremberg Code? Now, it's obvious why they changed the name of the document to the Nuremberg Code from, instead of permissible research on human subjects, because that emphasized the fact that doing research on human subjects is a good thing. They wanted to argue the fact that these doctors were doing something that was morally impermissible, not permissible. So they simply changed the title, and in changing the title, began to use the code to question what was going on in the United States. Not surprisingly, many of the questioners were Jewish, because Jews remembered Nuremberg when almost everybody else forgot about the Nazi doctors and the Nazi and the war crime trials. Next, please. Okay. This is Henry Beecher. He's the subject of 45 pages of David Rothman's book and of 9 pages of Johnson's book. What I want, excuse me, this cup of tea. What I want you to notice, he is in military uniform. He's standing by a map. He got 5 awards for courageous service as a physician in the military during World War II. He served in the brutal North African campaign. He had to ration penicillin because there wasn't enough to treat the wounded at one of the bases he served at during that campaign. And he had to figure out whether or not the rationing of penicillin, who should get penicillin and who should not. And in the end, he said, if you got VD, sorry, buddy, if you got VD, you're going to get it because you can get up and fight in a week. You don't have VD, sorry, buddy, I got to get new fighters into the field. And that is going to be his model of the kind of decisions you have to make if you're serving your country. You have to remember that. Because even though Beecher is the hero of Rothman's book, he was recently stripped of honors by the Hastings Center, a bioethics think tank, for things he did during the Cold War. Okay, Johnson gives 9 pages. Now I want to do something that's going to be a little tedious, but I want to take those books apart and show you what they focused on and what they didn't focus on. Next slide, please. Oh, sorry. A little bit more about Beecher. He opposed the Nuremberg Code when people attempt to implement it in the United States. It was never designed to be an operational code. It was designed to justify research on human subjects. And so when anybody tried to apply it in a clinical context, it didn't work. It had too many things in it that did not work, especially there was no provision for surrogacy. None. And so that meant nobody could do research on healthcare for children. Nobody could do it for people who lacked legal capacity because they were in a psychiatric hospital. Nobody could do it on people in the emergency department who are unconscious and so on. So it was for all practical purposes not a useful code for clinicians. But sorry, remember what I said about Beecher and his views on patriotism and the tough decisions that you have to make. Both the CIA and the US Army came to him and funded experiments on people, Harvard undergraduates, other people, to perfect a psychedelic drug because they were looking for a truth serum. Beecher said, okay, this is a Cold War. I've got to serve my country. I don't want to corrupt these experiments by telling people that they might get psychedelics. I'm just going to say, we're testing a new drug. We'd like to try it out on you. And so he did these experiments. None of them proved fruitful as far as anybody can see. No permanent harm was done to anybody. No harm at all was done to anybody, but it was unconsented. It was illicitly consented experimentation. As he was conducting these experiments, he began to write, to think out loud, and to publish his thoughts on human experiments throughout the 1950s. And then he grew, and then he became very concerned about lots of other people's experiments. And he signaled this concern in medical publications. He brought it before some hearings of the US Senate, and he said it had all the impact of a soap bubble, no impact whatsoever. He grew very, very frustrated, and out of his frustration, he's going to contact Maurice Papworth, who's a whistleblower in England. More on this in a little bit. Next slide, please. Oh, stop. I want you to look at that picture of Beecher there. He's all in white. He's in his Harvard office. He's got this great mural behind it. This is an empowered researcher, respected around the world. He's going to put all that at risk by blowing the whistle. And people are going to pay attention to him in ways they did not to other people, although he had lots of problems. And if I have time at the end, I'll talk about his problems. But one thing, nobody wanted to publish what he had to say. The editor who accepted what he had to say, oh, next slide, please. I believe I've got the image of it. Okay, that's the article that caused the stir in which he outed 22 unethical experiments. It came from the June 16, 1966 article in the New England Journal of Medicine. He was turned down by JAMA. He was turned down by Science. He was turned down by, I forget the third one. And everybody thought it was an article that should not be published. When his publisher, whose name Garland, or Joseph Garland, when Joseph Garland agreed to publish the article, he was retired the next year as editor of the New England Journal of Medicine because he overrode his board in order to publish this. It is now the classic work on unethical experimentation on human subjects. Next, please. What's the focus of the standard narratives? Those little numbers in parentheses are page numbers. You see Rothman in red in the upper left-hand corner. If you take a look, those are government commissions, 54 pages. Beecher, the hero of his narrative, 45 pages. Senator Mondale, 21, Senator Kennedy, 11, Senator Javits, 7, Senator Kefauver, 5, a theologian, Paul Ramsey, 5. As to actual bioethicists like Robert Veitch, 3 pages. Kelsey, 2 pages. Helligers founded the Kennedy Institute of Ethics. Andre Helligers gets 1 page. Leo Alexander, the hunter for Nazi doctors who documented their experiments, 0 pages. Andrew Ivy, the man who thought up the idea of the Nuremberg Code, 0 pages. Papworth, the British whistleblower, 0. Gibson, another American whistleblower, 0. George A. Wiley, the African-American who got us the Patient's Bill of Rights and who got rights for Medicare patients and Medicaid patients, 0. So you all know, you can see visibly, he's interested on the people except who can change policy. Policy is his focus. And if they're not policymakers, he's basically not interested in it. Johnson's book. Johnson's book came second, and it profited off of Rothman's work. And you're going to notice that right on top are theologians. Paul Ramsey, 34 pages. John and Joseph Fletcher, 32 pages. I forget if that's each or individual or in total. Dick McCormick, 14 pages. 2 popes, 12 pages. A total of 110 of 415 pages of his book. 1/4 of his book is focused on theologians. That's not surprising because Al Johnson was a former Roman Catholic priest, and he later became no longer a priest. I'm blocking on what that process is. And he thought that it started with ideas, and he wanted to credit the theologians with the ideas. Second most important for him were legal cases, but he does focus on Callahan, a former Catholic who became apostate over the issue of women's health care and abortion, 29 pages. Robert Veitch, the first employee of the think tank, the Hastings Center, 24 pages. He mentions Martin Luther King Jr., the civil rights leader, on 2 pages. The second most important thing, or the third most important thing, are conferences, 24 pages. He gives 2 females, Kelsey, 3 pages, and Pat King, who was a colleague of his as a lawyer at Georgetown University, Patricia King, mentions Beecher on 9 pages, but Alexander actually and Ivy get 4 and 3 pages. He recognized that Papworth exists, and so does Buxton. For Gibson and Wiley, 0, 0. Here's how both described the National Welfare Rights Organization that George Wiley started. It was an advocacy group for persons on welfare. So I'm going to show you a little bit about the NWRO. I want to start with giving credit where nobody else does to George A. Wiley. Next slide, please. Sorry. Before I do, let me, this is Johnson's summary of the birth of bioethics. Bioethics moved with a certain tranquility through the tempestuous moral turmoil of racism and warfare that was contemporaneous with its origins. Still, the work of revising the commandments of medical morality in such a way as to permit, even encourage, medical progress was done in a relatively quiet way. So this is Johnson's personal experience. He was on many of the commissions that founded the laws and regulations governing human subjects experimentation. Next slide, please. This is George A. Wiley. He, go down the 3 clicks, I think. Give it one more click. Okay. Stop. Yep, 3 clicks. I was right. He was a veteran. He served in ROTC, only served stateside, so not a war veteran. He went to UCLA. He became a chemistry professor. He did a year or 2 at Berkeley. He then was on a tenure track or tenured position. I didn't get into the papers to find out, at Syracuse University. He resigned his professorship at Syracuse to join CORE, the Congress on Racial Equality. He then argues with the CORE leadership that they're missing a large group of people. They're leaving them out. They're not taking care of women with dependent children. They're not taking care of people on welfare. So he starts a different organization, the NWRO, the National Welfare Rights Organization, in 1970. And look at that organization carefully, because at the time, the regulations for the implementation for Medicare and Medicaid are being argued out in the Department of Health, Education, and Welfare, as it was known at the time. And he wanted to make sure that people on welfare got the same treatment in medical centers as anybody else. That was his fundamental concern. And most of these women on welfare and people on welfare that he was concerned with were Black, but he did not want anything focused on Black. He wanted a universal rule that would embrace everybody on welfare, irrespective of whether they were Black or white. And he worked the regulations governing the hospitals receiving Medicare and Medicaid were being ironed out, were being subtracted to a group called the Joint Commission for Healthcare Accreditation. And so he began to work with them. And in 1970, he secured equal rights for Medicare and Medicaid patients using leverage from his organization. In 1972, he secures a patient's Bill of Rights from the American Hospital Association. Next slide, please. That, by the way, is a picture of the National Welfare Rights Organization in a protest. This group, you'll know that it's got indigenous people, it's got African American women, it's got Hispanics, and then they're behind it in a separate thing where another banner with Asian American women and men, and various subgroups, people with disabilities, blind people. They would all receiving welfare, and they would all join these protests. Now I want to go, could you go back 2 slides, please? One more. No, Johnson says this all starts with a certain tranquility and nothing to do with racism. Had nothing to do, we just sat away and we made a couple of regulations, and that's how all the changes happened. I want to contrast that, go back to and one more. I want to contrast that with this image. Go forward one way, go back one more. That image. That's the group that George A. Wiley could convene with a drop of a hat. And he can do it in any city in the United States, and he could get all these people to come out. And that was his leverage. Next slide, please. All right. Now, you might think, look, George A. Wiley, small group, nobody knows of them. No wonder they were left out of these 2 books. This is an article from the New York Times. Civil rights leader, 42, who headed welfare group, is sought off Maryland, feared drown. He was a nationally known civil rights leader. Everybody knew his name. Everybody followed him. This was a major organization in the 1970s. There are archives with his papers. He's an important figure. And anybody, either Rothman or Johnson, would have known of him and would have known that the NWRO was associated with civil rights, and that most of the people were people of color. Next slide, please. I want to give you a sense of George. I mean, I read his writings. I admire him enormously from what he said, what he accomplished, and even more the vision he brought. For too many lengths of time, the poor have waited for the most meager and inadequate and most stingily given out medical treatment. The poor have been kept on the short end of the medical facilities. The medical establishment have run a colonial empire on the poor, on the Black, on the minorities in this country. For too long have physicians protected their membership and defined the limits of access to healthcare by the people of the ghettos and barrios of our country. I mean, he was standing up for the people of the ghettos and barrios, for people who are blind, for people who are disabled, for people who are hearing impaired. And he wanted to have it as a civil rights, in his view, were universal rights, not necessarily the rights of any one group. And he reached out to all these groups effectively. Next, please. Okay. One group which heard and recognized his achievements early on were the Boston Women's Health Book Collective. Go to the website. They tell the story of how they were formed. These were mainly white women. There was a separate group, again, of Asian American women who were formed on the West Coast. And both of these groups recognized the achievement in a patient's Bill of Rights. Next slide, please. Skip this slide and we'll come back to it. Okay. And in the first edition of Our Bodies, Ourselves, and also in the first edition of the first Bioethics, it's the first important bioethics textbook, Beecham and Childress, Principles of Medical Ethics, both reprint this, a patient's Bill of Rights. And here are some of the rights given. First right to respectful treatment. The number one right demanded from both the Joint Commission and from the right to be treated respectfully. And that carried with them the right for advanced appointments. Now, Johnson actually apologizes for that. He thinks it's trivial, but if you understand structural racism, structural classism, there's nothing trivial about it. Because what would go on was at the clinics, there were no waiting rooms. There were no advanced appointments. So if you came with your kids for treatment of some sort, there was a line and you had to wait on it. And you might not be treated. And any middle-class person walking by that line, that queue, that mill of people waiting to be treatment, would know that the message being sent is, if you're middle class, you're better than these people. And the message to be sent to these people is, your time doesn't count. And so subconsciously also, you don't count either. You're mere charity patients. And so one of the rights they insisted on is, if somebody's receiving Medicare or Medicaid, they have the right to an advanced treatment, no more lines. Next, please. Right to be informed of diagnosis, prognosis, whether the treatment is experimental, and your options and alternatives. Again, that anticipates what the bioethicists are about to do. Next line, please. Right to consent to medical procedures and experiments, and most importantly, for people on welfare, next right. Right to have your treatment refusals respected. You can't blackmail somebody by threatening to not to treat them at all if they refuse to participate in your experiment. Next, finish out the slide. Right to confidentiality. Next. Right to be informed of physician staff's relationship with medical schools and institutions, so that they know whether or not there's a conflict of interest and where they're being referred, on who's paying the doctor or the nurse or the receptionist. Okay, I want you to go back 2 slides, please. No, stop, that one, Parsons slide. Yeah. Keep going down to the bottom of it. Thank you. Okay. In 1951, Talcott Parsons, the leading sociologist, America's leading sociologist, tried to understand how people thought, the way people thought of healthcare and other parts of the American society. And so when he interviewed doctors, this is how he captured the way doctors thought of healthcare and their relationship with their patients. Non and irrational mechanisms were noted by doctors as prominent in the reactions of sick people to their situation and their families. So the doctors told him that because the physician is a technically competent person whose competence and specific judgments and measures cannot be competently judged by the layman. The layman must therefore take these judgments and measures on authority. All the physician can say to the patient who refuses to heed his advice, well, it's your funeral. And Parsons add, this is him speaking, this last line, agreeing with what he's reporting, which it may be literally. So this is the attitude that people encountered when going into a hospital, when going into a doctor's office. Next slide. And this is the argument. This is what's being countered in a patient's Bill of Rights. It had a special bite in the 1970s. Next slide, please. It was, as I said, included in I've got the second edition. I should have taken a picture of the first edition, I'm sorry. In Beecham and Childress Principles of Biomedical Ethics, which is going to disseminate a new conception of bioethics, which we don't have time to go into in this talk. Next slide, please. Now, this shocked me. After going over the original documents, thinking about myself about what was going on in the 1970s, I countered this statement in Johnson's Birth of Bioethics, the standard book. To qualify for Joint Commission accreditation, that these are the standards that are going to be required of every hospital receiving Medicare and Medicaid funding. Hospitals printed a Bill of Rights. Aside from this Bill of Rights, the patient's Bill of Rights was a moral fraud. For the rights contained were not wrest from a tyrant by an aroused and offended people, but were defined and granted by noblesse oblige, with a content, extent, and duration at the will of the grantor. You notice this wipes out George Wiley. It wipes out the NWRO. It literally whitewashes history there. It just takes it as if, this was something that the the NWRO did from the goodness of its soul. Willard Galen, he's the co-founder with Dan Callahan of the Hastings Center, a bioethics think tank. Willard Galen criticized a patient's Bill of Rights as the thief lecturing its victims on self-protection. It was nothing more than hospitals returning to patients the legal rights that hospitals had stolen from them. This is fictitious history. That's not what happened. Next slide, please. Okay. I want to point out that a patient's Bill of Rights is, in fact, a statement of rights, rest from a tyrant, the American Hospital Association, and the Joint Commission, by an aroused and offended people led by George Wiley. Now, the yellow bars are taken from an interview with a member of the National Welfare Rights Organization. She said most private docs, most private MDs refuse to take us. We get whatever doctors are in the clinic, and the clinic is crowded, and we are waiting in line a long time. Notice, no chairs. If you go to a clinic, you stand waiting in line, and then we are pushed through. There is no time to ask questions. And I gather that's capitalized because it was emphasized by her. She's a member of the National Welfare Rights Organizations being interviewed, just an ordinary person. Member, sorry. We need services. That's what my group, the NWRO, expects. The way these rights were gotten is Wiley threatened them, the NWR threatened them, the Joint Commission and the American Hospital Association with picket lines of Black women and their children if they failed to acknowledge patients' rights, which raised radical questions about the prerogatives of the doctor's role, because implicit in these rights was the belief that doctors and patients' interests diverged and that patients need protection from doctors. Really radical conception of the physician-patient relationship, and especially for anybody on welfare at that time. Next slide, please. Okay, I'm going to switch to somebody else who is given George A. Wiley is just not mentioned in these books. NWRO is given a very brief, but really not paid attention to in this group. But somebody else who is paid attention to, and that's Frances Oldham. That's her maiden name, as they used to put it. Her unmarried name, Kelsey. That's her husband was Kelsey. And she was born in 1914. She was a Canadian. She did her master's work and got a PhD and later an MD from the University of Chicago. They accepted her because they did not recognize that when Frances is spelled with an E, at that time it meant it was a woman's name. Spelled with an I, it was a man's name. And when she showed up in Chicago, it was surprise, you just hired a woman, and they accepted her. She went on to become associate editor of JAMA, the Journal of the American Medical Association. She helped doing the research that led to the founding of the federal drug. It led to the Federal Drugs and Cosmetic Act, and hence to the founding of the FDA, the Food and Drug Administration. And she then retired from, she was teaching at the University of Chicago, and then she retired. She went to the Midwest, Nebraska, I believe, and she had some children. She had a family practice, and she taught at the local university. And then when the children grew up a bit, she went to work for the FDA down in Virginia. That's briefly a brief biography. In the center, you're going to see her receiving the Congressional Medal of Freedom or the Presidential Medal, I forget which one, from President John F. Kennedy, and she got it because she prevented thalidomide from being prescribed in the United States. On the right, you see her on her 101st birthday. And she deserved every year she lived, because she, in my book, is a hero or heroine, depending on whether you want to put the feminine suffix on the word, not only of the FDA, but of bioethics. So next slide, please. Okay. That picture is of a European child born in the 1970s. May have the date wrong, but I think it's right, with thalidomide. And the thing about thalidomide, you'll notice that little stump where her arm should be, she has no arms. These babies are born often with fetal anomalies, and often they had no upper limbs, or they were cleft, they were part of their bodies or improperly grown. And so she is using her toes to play with blocks in that picture. It is both in my view, both poignant and sad. And the saddest thing, next slide, please. Okay, stop. So Johnson recognized that Kelsey refused to approve thalidomide for use in the United States. And here's the backstory of that. I don't know if I've got it on slides or not, but I can give it to you. So Kelsey is a new hire. She's come away from private practice. She's been hired by the FDA. And her first case is a case for permission to market thalidomide in the United States. And it was being marketed as a drug for a sleeping pill for pregnant women. It had been improved in West Germany. Germany was split between East and West. In virtually all over Europe, several places in South America, and in Canada. and they had tested it on pregnant women, and they found no bad side effect on pregnant women after several months of taking the drug. There was nothing seemed to be going wrong, and used this clinical data for to get approval in all over Europe and in South America and in Canada. And they brought the same stuff to Kelsey and say, look, it's been approved all over the world, doesn't harm pregnant women, approve it. And Kelsey said, no, wait a second. There are two patients here. There's a woman and a fetus. What about the fetus? Give me your data on the fetus. And if you haven't got data, go get it. I'm not going to approve it before you show me that it doesn't harm the fetus. Next, go down one click. Okay. And okay, a story of commercial greed and political collusion. So let's go to the part of the story that Johnson does sell. The company went over Kelsey's head. She was a new hire. What did she know? And basically said, give me somebody else or fire this one. Come on. You know, we've got all this stuff. And they showered the company with testimonials from doctors all over the world saying, this is a wonderful sleeping pill. It's not addictive. It's got all this other stuff. It's great for women. And of course, they went to people in the Senate and they tried to put pressure on the FDA. And the FDA, to its credit, backed Kelsey. He was one of the researchers who helped found the FDA. And how does Johnson represent it? This is, of course, a story of moral courage, but it does not, in a strict sense, pose an ethical problem. And this struck me as nuts. I mean, look, I've got a PhD after my name. I wrote my thesis on G.E. Moore's Principia Ethica, a book probably nobody listening has ever heard of, but it was very influential and important in the early 20th century ethics. And that gives me a credential, but ethics is not something you need a credential to do. Anybody can ask, well, people think this is the right, but is this the right thing to do? The kinds of, I view it, when I was a kid, I used to play catch and sandlot baseball, and there were professionals out there. The game that I played was the same game that they play, only they've got a lot more training and they get paid for it. I think it's the same for ethics. What you and I, anybody listening, knows how to do ethics. You know how to ask the question. Yeah, they say this is the right thing, but is this really the right thing? They say that's the wrong thing, but is it really wrong to do that? And when you do that, you're doing ethics. And that's clearly what Kelsey did. She asked, they say it's all right just on the data on the mother. But I that's got to be wrong. And when she did it, she asked the same thing that anybody trained in bioethics would have asked. We may use fancier words, we may have a literature behind it, but it's the same question. So he is in effect arguing that somewhere she did not know how to handle an ethical problem. Remember, she might have gotten fired from that. She put her job on the line, but she kept her integrity intact. She's a hero or a heroine in my book. Keep going. That's page 142 of Johnson. I want to give you a little bit of Frances Kelsey in her own words, not in my words. This is her exit interview from the FDA. It's a public document. Anybody can get to it. In fairness to both Rothman and Johnson, her exit came after their books came out, so they did not have access to this document. I'm not sure it would have changed anything, but they did not have access to it. So this is her speaking. Senator Jacob Javits of New York raised the question, do people know they're getting an investigational drugs? I'm going over time, I apologize. Do people know they're going? It was clear from our survey of 1,000 doctors in the thalidomide case that many mothers and patients had not been told this. So a very important amendment to the law was that patients' consent must be obtained before a new drug, an unapproved drug, was given in a clinical trial. We never imagined we could have gotten away with it because the doctors felt that they were Lord Almighty. Remember, she's got an MD degree, that the patient should take what the doctor gives them because the doctor knows best. And if the doctor thinks it's important that this drug be studied in a fashion that the patient does not know he gets an unapproved drug, not to worry, Big Daddy will take care of you. Flip through to the next slide. Here it is. Okay, she was the Lord's Almighty One. She was taken off this, and she lost in the last line formal control over investigational drug unit and suffered what a reporter described as a humiliating bare desk treatment. She was ignored and given little to do as a consequence. All right. But what got me is, why wasn't she credited with doing ethics? Apparently, in my view, because protecting babies, cleaning up linguistic messes, that's women can do that. But when you call out paternalistic male doctors as Lord's Almighty, that's uppity, unfeminine, and we don't want to discredit it in our books. At any rate, flip through the next couple of slides and I'll terminate it. We're going to skip Peter Buxton. So sorry about that. I can send the slides to people. We're going to skip this. Skip Tuskegee. Skip Tuskegee. Okay, so I decided to write another book, a different book. The title of my book, the working title, you never know what the book ends up being titled. I've got the manuscript. I'm working on the bibliography. Should be in the hands of MIT Press in a month. The title is Making Modern Medical Ethics, a history of how African Americans like George Wiley and others, anti-Nazism, that's Ivy and Alexander and Hyman and all those other people who aren't mentioned, bureaucrats, commissions, Kelsey is a bureaucrat, commissions, feminists, think tanks, veterans, and whistleblowing moralists turned modern medical ethics into bioethics. So I hope you understand why I felt it necessary to write an additional book and some flavor of the sort of stuff you'll find when the book comes out. If you get a copy from a library or any other way. Thank you very much, and my apologies for going 7 minutes over time. Oh, this just gives you a picture of the stuff in the chronologies of my book, and this goes on for another slide as well. It's a much richer conception. It involves more people. It shows how more things interplayed to create the field about bioethics. If you want to chat about something, tell me you watch this and you'd like to chat. My email is baker.r@union.edu. Thank you very much for staying around. Cheers.
I think we have time to take some questions if you're up for it,
I'm
Professor
up
Baker.
for it, sure.
All right, great. So what I'd ask is if people can to use the raise hand function so I can see who wants to ask a question.
It's obviously true, right?
So somebody asked, can we get the slides? So Professor Baker, is it okay if we share the slides?
Sure.
We'll include that with a copy of the recording for all the registrants. Are people able to raise hands? Okay, great. So I see Lachlan Farrow, excuse me, has a question.
I'm just going to ask you, so thanks for your great presentation and the books you've already done. I see familiar faces on the screen, people involved in bioethics programs. So if you had a few absolute core messages for anybody who's trying to teach medical students or health professional students or others about how even to think about bioethics, and sort of teeing that up as a longtime director of ethics programs at Beth Israel Hospital. I put some things in the chat. We tried to stress that bioethics is not about bioethicists with PhDs and all of that, that every single human being represents values and their voices matter. But could you distill what we need to all be saying almost as mantras as we build the right kind of field of bioethics with the right kind of people driving it?
One of my other motivations is it struck me that when you take these people out of history, when you take George Wiley out of the history, yeah, you're taking out a role model for people of color. It's as if this field should belong to them as much as for anybody else. In many ways, they started this field, and that shouldn't be. And when you don't tell the full Kelsey story, you're not giving role models for women. She is a role model of integrity, and she did bioethics before bioethics got a name. So I agree with you entirely. I never thought of ethics in any way as something that ordinary people shouldn't do. I think that's an insult to ordinary people. I think every time.
Yeah, actually, and just as a concrete example, because I see my cherished friend Reuben Warren, who's the director of the National Center for Bioethics at Tuskegee, at the National Center, Dr. Warren's been crucial in this. The voices of the descendants, because all of the men have passed away, are central now to what the National Center for Bioethics at Tuskegee even understands the topics to be, and also what voices need to shape understanding about what those topics are.
Sounds good to me. I believe in that, but when you said about PhDs talking to me, that's the wrong field. I mean, what I try to do in the various books I write is to write in a way that's accessible to anybody who's interested in the subject, and not to write using technical gobbledygook. And if I use, sometimes you got to use it. I use synecdoche in this book, which means using a small piece of a name to represent something more complex, like when we say Yankees for New York Yankees, because I was trying to figure out why Beecham and Childress's mantra got so much play. And the answer is that they're synecdoches. So you can remember the key word without having to know what is all behind it and so forth. So, and then I'm trying to explain the pedagogical strategy and why it was such a bestseller and this sort of thing. So I'll use the technical terms if I have to, but then I'll find some way that anybody can catch on to make it accessible. But I really think having the descendants of those involved talk about what it meant is a wonderful thing to do.
So next, I'm going to call in Sue Lederer, but before I do that, I just want to say, because I think some people probably have to go to some things this afternoon is that next Thursday, October 20th at 7 p.m., the bioethics program is having an information session about our master's degree and graduate certificate programs, where you can learn more about the kind of stuff that Dr. Baker's been talking about today. And with the slides and recording, there'll also be a link to that session for anybody who wants to join it. Dr. Lederer.
Hello there. Bob, thank you so much for that great talk. You don't need to justify giving us another book. We welcome it, or I'll speak for myself. I welcome it. So I assume that you also know that Henry Beecher's article in 1966 had race taken out of it. That the editor purged, who the populations were, and several of them involved African-American subjects. But the New England Journal insisted that race be taken out. Participants. But my question is, I love your title. It's a little lengthy, your perspective title. I noticed it seemed to be in alphabetical order, the groups, African-Americans, feminists, anti-Nazi. I mean, I didn't do it in alphabetical order. I just wonder, I'm not asking you now, but would you say that some groups were more important than others? Or are they all equally important? Or are they all but they're just part of this diverse array? I'd welcome your answer.
They did different things, and it was important at different times. It is such a complex phenomena. If you think about it, it's absolutely nuts that somebody who wrote a doctoral dissertation on G.E. Moore's Principia Ethica would be in hospitals advising doctors about anything. Right? I remember once I was in one of the Boston hospitals, and two people, one person they thought was going to get a Nobel Prize, another person, they were extraordinarily distinguished people, and we were chatting about stuff. I've always had a bit of imposters. I come from the Bronx projects. I always have a bit of imposters syndrome, but I was part of this conversation, and part of me would say, how come I'm sitting here, So it's an incredibly important at some times. Let's say William Hyman, who was the lawyer who brought the Jewish chronic disease case up to the courts and then to the New York State Board of Regents, that he did it at that time because, as you probably know, that was the case. That was the index case for Beecher that led him to write in a letter to Papworth saying, this is driving me nuts. And what drove him nuts was the fact that they went to a committee, and the committee then said, this research is okay. And that was in the Science article. And then he says, somebody's got to speak up. And I quote your why me note that you found, which any indication that that parrots a little bit from a famous rabbi, I think actually Hillel. Would he have been knowingly parroting that when he wrote that?
I'll have to look back at that. I don't know offhand. It's been a while since I looked at that material, but thank you.
And by the way, your research is cited. I'm deeply in your debt as well.
Well, let's talk.
Okay, anytime. Anybody else? Oh, it was good. Pleasure meeting you. I wish it was in person. I took retirement earlier than I needed to because I love talking to people in the flesh, and including students. And then Zoom took the pleasure out of teaching, except for occasional lectures now and then. Well, thank you all for listening. And anybody have any questions, shoot them at me. Take care.
Right. Thank you, everybody. Thank you very much, Dr. Baker, for the talk. I enjoyed it, and I'm sure our audience did too. And hopefully soon, the bioethics program will start its own regular speaker series of lunchtime webinars, and you'll join us for those. So thank you again, and we'll conclude the session.